Hello, good morning, everyone. Welcome. I'm Caroline Palmer from the Minnesota Department of Health Safe Harbor Program, and I help to coordinate the Human Trafficking Task Force meetings along with our sexual violence prevention team. That includes Mary Hopkins, Marissa Mergay, and Julia Tyndall, as well as Injury and Violence Prevention Unit Supervisor Beatrice Menento. Thank you for joining us this morning. As you sign in, please be sure to introduce yourselves in the chat and let us know where you're from. The Minnesota Human Trafficking Task Force is an informal statewide network made up of people from around the state. The purpose of the task force is to address human trafficking in Minnesota through services, response, and prevention. This includes sex trafficking and sexual exploitation and labor trafficking and exploitation of individuals of all ages. We convene these quarterly meetings, which include presentations to keep us all informed, especially during this time when we cannot meet in person. While we cannot have an in-person discussion, we encourage you to send chat questions throughout the presentations and we will answer them or follow up. We have over 1,300 people from around the state and outside of Minnesota who are signed up on the task force list, the Sex and Labor Trafficking Prevention Network listserv called MinStippen, and our Facebook page. Please sign up on these lists if you're not already on them to receive updates. Our meetings are recorded and the recordings are made available on the Trafficking Task Force website about a week after each meeting, and we will send an email announcing when it's available. Today we have three fantastic presentations. We'll begin by welcoming Dr. Brittany Lewis and Ariana Kopycinski from Research in Action, as well as Dr. Catherine P. Squires, Professor Emerita and Contract Specialist for Research in Action. They will present on the recently released Missing and Murdered African American Women Task Force report. Beatrice Menento was honored to represent MDH as a member of the task force. Next, we will hear from Julia Atella and Melissa Serafin from Wilder Research. They will present highlights from the 2021 Safe Harbor evaluation that was released in fall of 2022. And I will put a link to that evaluation report in the chat. Next, we will hear from Heather Callier, President and Principal of Ascend Consulting, along with survivor leaders and subject matter experts Lindsay Arf, Lateesha Coleman, Joy Friedman, and Bukola Oriola. They will provide a summary of the survivor leaders and subject matter expert capacity building project. And then finally, I will wrap things up with a brief Safe Harbor update. Finally, the Minnesota statewide human trafficking task force has evolved over the past decade. To better serve this community of partners, MDH is looking at shifting the way we communicate to our networks. So just as a brief reminder for our history, the Minnesota State Legislature established the task force at the Minnesota Department of Public Safety in 2006. In 2011, the task force transitioned to MDH. And over time, the purpose of the task force itself has shifted. The task force currently acts as a space to connect people and organizations committed to preventing and responding to human trafficking, acting as more of a network rather than the working task force it originally started as. We are looking at sustainability for this network and want to know what you value from this space. As MDH continues to convene this group to discuss human trafficking in Minnesota, what do you want to get out of it and what is working well? We will be sending out a survey where we will be collecting your feedback as we plan for the future. We will continue meeting and sharing resources, but we are considering the best ways to do this. We are considering moving communications to certain MDH channels like the MDH website and the government delivery emailing systems. These changes will help ensure that leading this group is sustainable and will improve the communications you receive from the group. And finally, we just want to incorporate your input as we consider these and other changes. So please be on the lookout for that survey when it comes through to you. So thank you so much for joining us, and I will turn things over to our guests from Research in Action.
All right. Hello, everybody. My name is Ari Kopycinski. I use she, her pronouns, and I'm a junior research associate at Research in Action. We are, Dr. Lewis is still trying to log in to the meeting. I'm not sure if she's showing up for the host, but I'm going to start sharing my screen, and then Dr. Catherine Squires can get us started while we wait for Dr. Lewis.
Greetings, everyone. There was Dr. Lewis. Excellent. I would just introduce myself again as she's getting settled into virtual world. I'm Catherine Squires. I am part of the team that put together the report for the Missing and Murdered African American Women's Task Force, and we're really happy to be presenting to you today, and are looking forward to your questions in the chat. And I will turn it over to Dr. Lewis.
Hello, everyone. I am Dr. Brittany Lewis, CEO and founder of Research in Action. I'm joined by my colleagues Ariana and Catherine, as they've already introduced themselves. We're excited to give you an overview of the report that was handed into the legislature December 15th of last year, give you a high level of our approach and strategy, as well as some core recommendations and findings that came out of the report, and leave you all with some reflection questions to open up a discussion. So we're excited to share our work with you. Okay. So what we will do in our brief time is explain to you the what and why of the Missing and Murdered African American Women Task Force, talk about our strategy and approach to centering Black women and girls in our engaged action research. We'll describe a bit about the root problems and real solutions, giving you a sense of how our literature review, which we co-design and develop with the task force and council, identify those root problems to help us co-design the actual research strategy and identify solutions. We'll highlight some key findings and go through the core recommendation categories and end with some reflection questions. Okay, the what and why of MMAW. So it's really important that we highlight the importance of why the Missing and Murdered African American Women Task Force was created in the first place. There are some stark and startling statistics that guide us to identifying this as an important space and place to explore for the purposes of developing solutions. Only 7% of Minnesota's population is Black women, but 40% of domestic violence victims in the state of Minnesota. Black women are also nearly 3 times more likely to be murdered than white women in Minnesota. There are many, many more data points that we could share in this space across the realities of health and wellness, education, housing, criminal justice, etc., that identify the ways in which Black women are often trapped into violent contexts. But we wanted to raise up these key statistics to highlight some components of the why both legislators like Ruth Richardson and others pushed for the creation of this task force. Something that's also super important for us throughout this presentation is to bring in the voices of Black women and girls that we have the honor to speak with. And this is a powerful quote that we will loop back to at the end that states, "You have to be bleeding to be heard." And this sentiment, which was shared across the actual council and throughout focus groups and interviews we had with Black women and girls all across the state, really was a strong context and guiding framework for us throughout the work, because many Black women and girls shared the same sentiment in different words throughout the work. So we want to make sure to highlight their voices throughout this process. So I want to give you quick context on the creation of the task force itself. It was created in 2021 and was the first U.S. state to dedicate resources to investigating missing and murdered African American women. The task force was charged to examine systemic violence, causes of violence against Black women and girls, appropriate methods of tracking and collecting data, policing practices, institutions that assist in perpetuating violence, identifying measures necessary to address and reduce violence, and also measures necessary to help victims and their families and their communities. And Research in Action was honored to be asked to be a part of that process. However, in that request for Research in Action to be the firm that would both hold space for the task force to guide the process and kind of co-produce the legislative report. Research in Action also had to assert that our organizational value requires that whenever we're doing a project such as this, which is the bulk of what we do organizationally, that the community have to guide the process. So we created a mirrored advisory council guided by Black women and girls who are either sex trafficking victims or have lost loved ones as a result of violence. And we set up a process where the advisory council actually guided the task force. And the task force was populated with a number of folks that might have had organizational expertise, which was valuable. However, we argue at Research in Action that communities should be empowered to actually co-develop the approach and the actual research questions that we would pursue. So that suggestion was welcomed, and we became the first task force to have a council to guide its work. And we developed our engagement strategies to ensure that we had touch points with the council first and that there was a collaborative synergy between the direction of the work as a result. What did it look like for us to center Black women and girls in our research? So first, what's super important here is traditionally, I would argue that when engaging with questions about the lived realities of Black women and girls, the conversation often happens in a deficit-based way. So too often Black women and girls are objects of study, are the problems to be solved. And that is not something organizationally that aligns with our values. We prefer to take an asset-based approach when partnering with community. However, what you'll see an image on the screen, we spent a great deal of time working with the council and the task force to identify what they believe to be the root causes of violence against Black women and girls. What you see here amongst this very powerful image are many things that Black women and girls themselves identified as part and parcel to those root causes, which are explored in depth in the lit review. So we chose to take an asset-based approach. So what does that mean? What does that look like? Black women and girls must be seen as valuable members of our community with the ability to identify solutions to their own problems. So in short, that means we have to engage with Black women and girls from that place from the very beginning. And what you see here on the screen, within our intake process, when we were out in community doing focus groups and in-depth interviews with Black women and girls, we gave Black women and girls the opportunity to first answer the question around what brings them joy, and perhaps how their loved ones, family members, and others would describe who they are or their contributions to community. And what you see here around this image of a Black woman are the things that Black women themselves raised up about who they are, what brings them joy, and perhaps how those that love them the most would describe who they are. And that matters a great deal. Although we're going to have in-depth conversations about very hard, emotional, perhaps violent moments that they've experienced in their lives, we want to first lead with what's powerful about who these women are. Something else that's super important for us to raise up, and as a value at Research in Action, we believe deeply in mixed method research. And in short, that means we value quantitative research as much as we do qualitative research. However, what's super important is that we are raising up the importance of lived experience intentionally to create space for Black women and girls to share their lived experience with direct insights. We can create a lot of pretty charts and graphs, but it doesn't tell you the context of what it means to live that reality. And I think both need to exist at the same time. So lived experience for folks that want clarity is simply means that firsthand experience that come from those that live that reality every day. And in our minds at Research in Action, someone with lived experience is determined to be the expert and closest to the problem. So I'd argue they're closest to the solution. And something else I want to raise it up before I hand it to my colleague, Ariana, is that in addition to working with Black women and girls on the council to guide the research process and how we ask questions, we also worked with the council to identify what a definition of violence is. I would argue in any given context, when we we create new tables and we develop a strategic coalition, there's assumptions made about our shared understanding around particular terms or histories. And it was super important for us not to assume that every participant and empowered leader at the table define violence in the same way. So we had to define it together. And here's a definition of violence that the council developed and that we actually used to frame out our research. And their definition was violence that encompasses and includes physical, emotional, mental, spiritual, and monetary violence. Our definition of violence goes beyond the physical aspect of violence to the adverse conditions that inflict harm on individuals and groups. Economic, social, and psychological violence undermine well-being and reduce access to resources that help people recover from physically violent incidents. This broader definition of violence also illuminates the importance of acknowledging the roles that systems play in generating disparities in violence and healing. So violence goes far beyond the physical, and this particular group got time and space to explore what that meant, and that meant as a research team, we had to design research tools that helped allow Black women and girls that we talked with in community to talk about violence far beyond just what they're experiencing physically. And I will pass it to my colleague, Ari.
So just as Dr. Lewis said, in addition to ensuring that each group had that shared language and understanding through the co-creation of definitions, Research in Action, the task force, and the advisory council collaboratively developed a robust data collection plan with a mixed methods approach with one-on-one interviews and focus groups to speak to our research participants. But before the interviews began, the data collection plan started with the development of two primary research questions and the co-design of those questions with the advisory council and the task force. And those questions were: what institutions track and dehumanize Black women and girls and make them more susceptible to the violence that we previously defined? As well as what needs to change to ensure Black women and girls are treated with dignity and respect. So the advisory council specifically guided our narrowing of these questions and definitions with their own lived experience, and then the task force went in afterwards to refine those questions. So this co-design honed in on 5 different systems that they identified as key to targeting in data collection, which are the systems that you see here, which is housing, child welfare, education, criminal justice, and domestic violence services. So we interviewed 2 different groups of folks, key informants who were experts in the systems that the advisory council and task force identified in that co-creation of their research questions, and then Black women and girls with lived experience. So these 2 groups totaled 35 research participants, and each group had a specific interview guide developed in collaboration with the advisory council and task force for their individual interviews and focus groups. And it was particularly important to the task force and advisory council to collect data from Black women and girls with lived experience for our analysis overall to inform how we wrote the report. So once the data was collected and coded, our team went through the analysis to look for themes that are coming up across the interviews. And that process began with the lived experience interview data. So as to center the experiences of Black women and girls. And this approach is totally in line with our core research values at Research in Action, which is to center community expertise and drive those actionable solutions for racial justice. And centering those who have been most harmed or by the current system provides crucial knowledge to shed light on why policies and agencies that are created to protect women have not done so for Black women and girls. So, engaging in that thematic analysis for the lived experience data created a sort of cipher for us to look at all of the data, including the ones from key informants. And we did have Black women key informants as well. So, that had additional layer of where they also had lived experience, but also institutional knowledge for which to look through that, the rest of the data through. And using that cipher, we looked at the different areas of overlap between the key informants and the lived experience interview. So overlap, the convergence and the divergences in the data. And this data collection and analysis process centered Black women and girls in both creating those shared definitions and creating the qualitative interview questions. But once analysis was complete, this process directly informed how the recommendations for the report were conceptualized. So this quote presented on the screen is kind of a perfect example of what this process looked like and how it informed our recommendations. So the participant was a Black woman with lived experience, describing how she experienced the quote unquote runaround with service provision and the many barriers that she faced in just getting somebody on the phone to speak with her about violence that she had experienced. And in some of our recommendations, we focus on improving agency coordination as well as hiring Black staff with lived experience so that survivors of violence feel heard as they're trying to seek resources. So you can see how the thread from our data to the analysis to the recommendations, how we threaded that needle basically. And I will pass it over to Dr. Squires to go over the root problems and real solutions.
Thanks, Ari. So before we get a little more deep into the findings, we're going to take a step back and look a little bit more at those root causes. So as one of the previous slides showed you, of course, part of the process for RIA and the Task Force and the Advisory Council was for us to do a literature review to think about the real background frame for these disparities that Dr. Lewis pointed out at the top of the presentation. And so understanding the roots, right, of how and why Black women and girls are so vulnerable to deadly violence really requires us to look at the longer history of what kinds of violence Black women and girls have faced in our country. And we really have to go back to slavery and the era of Jim Crow and the way that era as an expectation of Black labor to their bodies was central to the economic structure of the United States. So these dynamics were set up in slavery where Black women were not only unpaid laborers, they were forced laborers, they were also sexually exploited and violently exploited to produce new laborers. So Black women were forced to carry pregnancies, were forced to carry children to term in order to produce additional laborers for the enslavers. And so those two phenomenons set up these expectations of Black women to produce for others and to have their bodies abused by others that resonates across history. And it sets up some very disturbing cultural stereotypes that have lingered through time. That first, that Black women, white women, had the physical stamina to do forced labor and to be forced to childbirth. Those stereotypes that underlay that forced labor are that they were hypersexual, more defiant, and stronger, and thus deserved ill treatment, deserved violent treatment, and had to be controlled in those ways. These stereotypes simultaneously then reinforce the femininity and delicacy of white women, make them the perfect victim of persons affected, whereas women are not need to be affected. I'm seeing a chat from my face choppy, and I don't know why that is happening. I'm not going to that help. So hopefully my stop this make. So what exact is that? Okay. So it seems like I am not able to be heard.
Catherine, once you turned your camera off, it sounds a little better, at least for me. I don't know for others.
All right, well, I'll continue on, and if it doesn't improve, please let me know through the chat, and I will keep going. All right, I see it's better now. Great. So that base history of slavery-specific exploitation of Black women set up dynamics that really continue to this day. And so let's just take a look at one of the systems on this slide, the healthcare system. This history really plays out in healthcare, where the stereotype of the hypersexual, defiant, stronger Black woman leads to racist myths that Black women don't need as much pain medication or need to be told how to act when they are doing things like giving birth or talking to their doctor about the symptoms they are experiencing. And so these false beliefs, which still a very large number of medical students and practicing nurses and doctors believe, means that Black women get misdiagnosed and mistreated when they seek health care. And we see this coming out in the horrible statistics that the mortality rate for Black mothers is more than 3 times that of white mothers in the United States. And here in Minnesota, the mortality rate for Black mothers is over twice that as for white mothers. And the mortality rate for their babies is double that for white infants. And I do want to point out that these disparities in pregnancy outcomes are not improved when you factor for education and income. So for example, a Black woman with a PhD has a worse pregnancy outcome expectation than a white woman with only a high school education. But we also know that disparities in income and wealth make Black women and girls more vulnerable to trafficking and other violence. And again, these income and wealth disparities persist in large part because African Americans who were enslaved and their descendants, of course, never received any compensation for their forced labor, even after the Civil War ended slavery. And then furthermore, the slave era was followed by the Jim Crow era, a century of legalized racial discrimination and segregation in education, employment, and housing. So we can see how the economic inequalities generated by this historical backdrop affect the housing system. Employment discrimination, redlining, steering, and violence kept Black families from owning property and passing down wealth at the same rates as white families. And today, one of the results of this is that Minnesota is home to the 4th largest disparity in Black home ownership and the 2nd largest income gap between Black and white households. So this means that Black women and their families are more likely to experience economic hardship. And of course, if that economic hardship leads to houselessness, we know that being without a home means you are more likely to be a victim of physical or sexual assault. You're more likely to be coerced into trading sex for shelter and things of this matter. So just thinking about the system of health and housing, we can see how these roots of the disparities continue to resonate to this day. And those roots, particularly the stereotypes about African American women and girls, are resonant in our findings as well. So again, just to reiterate what Ari mentioned, using this asset-based frame and grounded in the idea that those who are experiencing harm are going to have the best eyes on what the solutions might be, our analysis of both the key informant interviews and the lived experience interviews were really driven by this cipher of lived experience as we did the analysis. And so the first finding that came out through the analysis is both key informants and folks with lived experience were adamant about the need to hire and retain people who care about and reflect the community that they are supposed to be serving. And so here you see this quotation that comes from a woman with lived experience who describes the ways she was shunned by staff to whom she went for help. And also, again, the runaround that Ari mentioned before, that people are put under great time pressure and told, if you don't do this, if you don't do that, you don't get anything. And so, again, that is re-traumatizing folks who have experienced violence. And so the main difference between the ways our key informants and the Black women and girls with lived experience talked about the need to hire people who care about and reflect the community is that the lived experience group was giving testimony to how they had been treated, whereas the key informants were talking about the need to, quote unquote, diversify their staff so that they could build trust. So they recognized that there was a trust gap with Black women and girls, but they didn't really speak to the reasons why that trust gap was there. The big difference there was that our key informants who identify as Black women, they also talked about the impact that racist and sexist stereotypes have on Black women and girls. To give you one example, the adultification of Black girls, and that's the phenomenon where Black girls are assumed to be older, to be more responsible, and to be more sexual than their white peers, and so are usually blamed for situations that they are in terms of sexual exploitation or violence by authorities. And we see this as well in disparities in terms of suspension and other discipline rates in schools, where similar behavior by white students that does not get punished is punished for Black students. So we can move to the next slide. Our second finding was that folks who are in MMAAW related agencies and domains need better training so that they really understand the experiences and perspectives of Black women and the core root causes of some of their vulnerability. And again, the lived experience interviews, as well as some of our Black women key informants, revealed how Black women experiencing violence would often experience more harm when they were seeking help. They talked about the ways systems professionals did not understand or respect them, and that there was a lack of trauma-informed training that had the specifics of this background in Black culture and history to really bring the right kind of perspective to supporting someone who had survived violence. And so as a result of these failures of training, many lived experience participants talked about feeling dehumanized and also getting, again, the runaround, that they were being passed off to different people instead of being listened to and were being treated with disrespect. And so this was a huge theme in all of the data. And so we can move on to the next slide. And the third thing that came through, both for key informants and for folks with lived experience, was that there just wasn't enough resources for this work. Our lived experience participants called for resources not just in the moment that violence happens and that they're seeking services, but also resources that would address the socioeconomic conditions that make them more vulnerable to violence. Many of the women who we interviewed talked of housing inequalities and housing vulnerabilities, and not being able to secure housing as one of the main reasons why they or their loved ones were exposed to violence. They also talked about getting resources in the hands of Black women and girls and the ways that they support each other when they are having difficulties, and their own ideas for supporting each other, creating spaces and creating ways to heal together that systems currently cannot provide. And so there's a strong shared belief, again, across both of the interview groups that more resources are needed to reduce the disproportionate harm that's being suffered by Black women and girls. And again, Black women and girls more often spoke about the need for resources that would prevent violence and harm, such as stable housing, educational programming, access to better healthcare services and jobs. And key informants were more focused on resources that would help them serve women and girls after harm or origin agencies. And so those were the three main findings.
Oh, okay. I think. All right.
Apologies. When we started out, everything seemed just fine. So
No, I'm really sorry. I'm hoping it's not a sound issue on our end, and I apologize to everybody for that. So we'll keep going.
The recommendations.
I'm gonna pop in, and myself and my colleague Ari will go over some of the recommendations. And just so you all know, in our process, our recommendations are also co-designed. So in short, that means after we do data collection, and we partnered with ADAPT, the Domestic Violence Project, Emery Shelter, St. Cloud, Zinbin, in North Minneapolis, and many other folks to support the outreach and engagement of Black women and girls in community. And we brought back all the data, cleaned it, thematically presented it, and we worked with the task force and council to make meaning of it together, and to co-design these recommendations that you see in front of you. There are 6 high-level categories, and within each category there are some specificity that we would love to highlight and underscore. I will look at the first 3 and then I'll hand it off to my colleague, Ari. So the first high-level recommendation was around establishing a missing and murdered African American women office. However, unlike and somewhat distinct from the missing and murdered Indigenous women's office, there are some things that this group identified as needing in resources and support that might look different. They would like the person or staff that work within this space to search for and partner with grant-making organizations willing to identify and provide direct funds to Black women-led community organizations and initiatives. They would like the leader and its staff to develop and monitor effective training protocols co-designed by Black women and girls, and those protocols to be mandated for use by local counties, law enforcement, public health professionals, etc. They saw working with Safe Harbor, the Bureau of Criminal Apprehension, local law enforcement, and shelters to develop coordination strategies. It became very clear to us, both in our attempt to do outreach, as well as in our conversations with Black women and girls, the lack of communication across counties and across entities. And they also looked for a monitoring and evaluation kind of annual review to improve coordination of services across agencies. This is in relation to the direct fund framework that came up. Create and fund specific spaces and resources to serve Black women and girls. This was based on lived experience and intergenerational knowledge that if applied with sufficient resources, they could generate better outcomes for victims of violence or those who seek support to reduce their exposure to violence. Direct funds should be allocated to efforts created by and for Black women and girls to address disparities and create new intervention and support models. There wasn't one particular model that came up in conversation, I believe it was in Duluth. It was a housing support program created by a local Black woman. And, you know, I can recall folks talking about how their experience in the local shelter versus in a community-based shelter was very different. I think that needs to be explored further. Next slide. Develop effective, culturally appropriate anti-racist trainings. Better, consistent training is needed for professionals who work with Black women and girls to build trust and repair historic harms. Training should be relevant to the specific area of service or professional field and periodic to build skills and respond to emergent issues. I saw some notations in the chat, and I'm more than willing, once we get to the open discussion period, to provide more context for that. I will pass it over. Sorry.
All right, so the fourth recommendation in our series is to hire and retain Black staff members within the systems that were identified by our task force and advisory councils as needing increased support, particularly relevant state agencies. So this is really important for reducing burnout and high turnover rates in agencies and service provision sectors for Black staff. We also consider that pathways need to be created for Black applicants with lived experience without the potential barrier of certain eligibility requirements for jobs, such as a college degree. So in that same vein, we recommend providing professional development resources to retain and supporting Black staff. And our next recommendation focuses on the better design and support of agency coordination for the many agencies and offices that serve Black women and girls, particularly that focus on missing and murdered African American women. So this is primarily to reduce bureaucratic barriers as well as to build trust between agency providers and those that they serve. So such coordination might look like coordinating service referrals across agencies and creating in making widely accessible a new statewide missing persons database. And our final recommendation in our report is a big one, enacting policies and reforms to make emergency and long-term housing accessible, especially to Black women and girls, and particularly focusing on eliminating prohibitory eligibility restrictions for existing shelters and creating policies that take into account the differing family structures that many Black families would would be an essential place to start. And that concludes like our set of recommendations, but we would like to go into what we're calling reflection questions, and reflecting on your role as service providers, and thinking about how to take what we've written in the report out into your world and out into your life. So as you will see in the Missing and Murdered African American Women Task Force report, each section has reflection questions for readers to consider. So we'd like to end our presentation with one of those questions for you all to ponder. What would it look like if Black women knew that they could seek support when they are in crisis without having to already be bleeding to prove that they're in danger? This question really emanates from the findings of our research and research and actions orientation towards finding actionable solutions. So the many negative and harmful experiences of Black women have had with existing systems make this question very relevant and urgent as part of redesigning systems. What would a system that could respond proactively to Black women and girls seeking help before that they were at this point of bleeding or worse? What would a system look like that didn't regularly cause additional trauma to Black survivors of violence? Can we imagine that system and make steps towards making it a reality in Minnesota and beyond? So that we also have a series of these reflection questions throughout the report. So this is another one in response to kind of this phenomenon that we talked about throughout our presentation about getting the runaround. So another quote that we'll lift up here is from our lived experience interviews about needing to go to 15 different places to get help. And by the time that you get to the 5th place, you're exhausted and you have nothing else to give or gain. And the reflection question for that is, what would it look like if our human service systems were created and designed by people with lived experience, as we recommend in our series of recommendations? And how might the processes and these types of support offered to community members look and feel different? So these reflection questions are peppered throughout our full report, which you can access here. I'll leave the QR code up. You should be able to scan it with your phone and it will take you directly to the full report. We also have an executive summary that condenses our information down. We also have an action toolkit available on the website for people to access more about these actionable solutions and taking our recommendations and these reflection questions out into the world and into your lives. Dr. Lewis, did you have any final words?
No, I think I want to give I think we have 15 minutes. I want to give it to the folks in space who have questions so that we could do our best within the time to answer them as quickly and directly as we can with the time that we have.
Thank you so much, Dr. Lewis, Dr. Squires, and Ariana. And I hope, Dr. Squires, that your connection improves a bit for answering the questions at this time. And just thank you so much for bringing this report overview to us today. And I know that Safe Harbor is going to be digging into this and doing what we can to act on these recommendations. We do have some questions here in the chat. First one is, how were Black trans women and girls included in this research?
Okay. So I can answer that really quickly. I think the reality was that we were sprinting with very little time. So there was very little direct attention paid to identifying the trans community. I'd argue a lot of other communities as well, mostly because of the legislative deadline and what we had the capacity for. I would argue that there's a lot of underexplored avenues that we could have looked at, would like to look at, and hope that there are partnerships out there in the world that want to explore that with us.
That's right. So hard when you have so little time and there's so many things to talk about. The next question is, can you talk about the fancy girl history?
I'm not sure what that's in reference to. Maybe something Catherine shared?
The question came up during Dr. Squires' presentation, so maybe that's a piece of history there.
What did someone say? Fancy girl history? Are you talking about the thing that comes to mind for me? Can people hear me?
Yes, you sound good right now.
Okay, good. Fancy girl history in the histories that I know is oftentimes mixed race women who were born of liaisons between white men and Black women were kept for the sexual pleasure of white men, and sometimes were paid and sometimes were not. And again, that feeds into the stereotypes of Black women as hypersexual and always seeking sexual attention from men. And that then bleeds into oftentimes police and prosecutors. Unfortunately, this is something that we uncovered in our lit review, is that they will often not pursue cases of sexual violence when Black women are victims or they will seek lesser charges because they do not believe a jury will believe that they were actually victims. So that is one of those legacies of the hypersexual stereotypes of Black women, is that even those who are meant to help protect them or seek justice don't believe they are believable victims as white women. That also bleeds into the ways that oftentimes Black girls are presumed to have run away instead of being missing. And so Amber Alerts are not as fast to happen for Black girls. And that's that mix of the adultification of Black girls and the hypersexualization of Black girls.
Thank you. Our next question is very curious to hear about what training and for whom may be needed and impactful. Would love to see more training for our child welfare workforce, but are not sure what that would look like.
I'll share my reading of how that came up in our analysis, and I encourage my colleagues, Dr. Squires and Ari, to do so as well. So when I both participated in some of these interviews and worked in the analysis, I think what came very clear to me was a part of what Black women and girls were sharing that needed to happen around changing or training was around cultural and historical awareness. I think there are things, when we hear the word training, I think we often think of, here's a skill I need to develop. And here's step 1, 2, and 3 to develop a skill and maybe get a certificate or something. That is not what Black women and girls were necessarily making reference to. They were making reference to a lack of either self-awareness, which when you talk about self-awareness, we're talking about interpersonal work, which is connected to our own individual identities and awareness of other people's identities. And we're also talking about historic and cultural understandings about a different culture or identity. I guess we cannot assume, like for myself, that I would have any deep-rooted understandings of certain components of Native culture because I am not myself Native and I have not been raised in that culture. So that requires me to develop a level of self-awareness about that culture and perhaps build deeper relationships, do more listening than talking. So I think half of the work that Black women and girls were referencing in the training space was about self-awareness work. I think the other half of the work was connected to the processes that we create in spaces, whether you're talking about domestic violence shelters or support agencies, to identify what supports a Black woman and girl would need, and if you actually have the capacity or cultural sensitivity to give it or not. And then do you have different tracks to support the Black woman and girl in that? So I'll allow Catherine and Ari to share anything in addition, but that is just my reading of what we heard in interviews and what it means.
I don't have much else to add other than that. Another thing that came up in our interviews was also just the piece about mental health and trauma-informed training that also can be added to this kind of interpersonal development work that Black women and girls saw as important for specifically serving their community. Catherine, I don't know if you have anything else to add.
Yeah, just to build on what Ari just brought forward in terms of an example, you can do trauma-informed training and never talk about intergenerational trauma, racial trauma, and think you are trauma-informed, right? That's not going to work for working with different populations. And so the question is, when people are getting trauma-informed training, does it have an intersectional lens? Yes, no, maybe. So that would be something to develop. The other thing is sometimes people, even if they are trauma-informed, they still might have a sense of what a victim looks like, and that is a racialized and gendered dynamic. And so what we heard a lot, especially from our Black women key informants, is the ways that Black women and girls who might be expressing anger at what happened to them, staff interpret that as defiance, right? And so a trauma reaction can be to fight. But when we think about the stereotypical victim of domestic violence or sexual violence, some people are still taught the freeze is what happens, that people withdraw and they are demure and they are quiet and they collapse in on themselves. And so when you take those stereotypes of Black women as being stronger, more sexual, and not as feminine, if you don't weave those understandings of that stereotype into how you might encounter someone, then you're going to probably misinterpret their behavior. So those are the kinds of more nuanced, or not even nuanced, but just that cultural awareness and self-awareness of whether or not you're projecting who is a victim onto someone who is in front of you. Those are racial and gendered dynamics that need to be understood so that people can unpack them and then better show up better for people who come through the door.
Great, thank you so much. Another question here. What could you maybe add that would be helpful as we try to apply these recommendations within the anti-trafficking movement? The person asking would love to hear more specifically about the intersection with trafficking and exploitation, both in terms of root causes and also findings and recommendations.
I have one piece, and if my colleagues had something else that seems ever present in this moment. When my colleague Ariana was talking about hiring more Black staff, something that I understand as a debate within the broader community is, what does it mean, or what are the conflicts inherent in having folks within, whether it's domestic violence shelters or support services, who are quote unquote victims themselves? I would argue that that's what Black women and girls said that they wanted. They wanted Black women and girls who had actual experiences living some of these realities, because they felt like they would be ever better to relate and would be engaged with differently. And that's what they were asking for. But I also understand within this broader community that you referenced, that is a tension dialogue amongst folks, not just in the state of Minnesota, but across the country. And at Research in Action, we argue that those with lived experience are the experts. And those folks should be supported to take on those roles and given professional development support to be in those roles, because that's what community are asking for.
Great, thank you so much. We have one other question here about the Missing and Murdered Indigenous Relatives Task Force and Office, and just, are you affiliated with any way with the task force work that was done by the Missing and Murdered Indigenous Women's Task Force?
So Research in Action did not have any role, association, or presence during the time of that former task force. We did, however, in our key informant work, interview the current leader of that office and took into account some of those learnings. But in the current moment, Research in Action does not have any direct working relationship with that office.
Thank you. It looks like you've made a connection in the chat, so that's great, with Anna Negretti, who will be joining that office. Okay, we have a couple more minutes if there are any last questions or comments to share with our speakers. It looks like we will be sending out the slides afterwards so that people can access those, and you've got the link for the report as well. Just a lot of thank yous for a great presentation. Anything else you would like to add before you wrap up?
Just thank you so much for having us.
Yeah, and I would say when you look at the full report, you'll see that the recommendations are broken down much finer with some of the things that Dr. Lewis was talking about. Like, if we were to have more folks with lived experience in jobs in these spaces, what would need to happen for them to get the right certification? What pathways could be set up? So there's lots of very practical thought in those recommendations that we put together with the task force and the council. So please do take a look.
Hi, this is Beatriz. I just wanted to thank you so much for sharing today and for walking through this information. it is very powerful. The work that was done was amazing, and I know that it's going to continue to move on and show itself in other ways. And I just wanted to recommend that everybody really digs into the report. There's a lot of information, and sort of pays attention to what's going on as follow-up, and remember that there's the resources are here with people that were involved in doing this and with RIA, and being able to share this information widely. So thank you for that.
Yeah. Thank you so very much for joining us today. And we look forward to further communication and conversation about this. And with that, we're going to turn this over to Wilder. But again, thank you so much for everybody from RIA for joining us today. Okay. All right. Now we are turning it over to Melissa and Julie.
Thank you, Caroline. Hi, everyone. Good morning. My name is Julie Atella. I use she, her pronouns, and I'm from Wilder Research with my colleague, Melissa. Before we start, I just wanted to echo what everyone's saying. That was just a really very powerful and moving presentation. Just really learned a lot. So thank you to Research and Action. Today, we're going to talk about some findings that came from our 2021 biennium report, which is one of the 4 that we worked on with the Department of Health. And we just have a snippet of some of the things that we have found during that time. And so I'll kind of chat in the beginning and then bring in Melissa. Let me pull up the PowerPoint and okay. So to start with, we were asked to do an evaluation, which included both qualitative and quantitative data collection. And our overarching evaluation questions included really digging into which kind of supports and services are needed and which ones are being provided to people who are going to Safe Harbor grantees. And so we looked to see how services and supports were culturally appropriate, and if they were for all who needed them, what factors contributed to Safe Harbor's impact, and we brought in key informant interviews for that. And then we also were trying to find, through meeting with people who participated and got services from grantees, as well as people who were providing services and other key stakeholders, what the gaps and challenges are that impede the work of Safe Harbor, and where there's areas for improvement. And then, of course, how COVID-19 impacted Safe Harbor services. Oops, I'm sorry. So for this discussion, we're just going to kind of quickly give an overview about the interviews that we conducted with youth and young people, and then our community respondent interviews. And I just also wanted to mention that we did work with Chris Stark, who as a consultant with lived experience, and she was able to, gather information and feedback from 5 American Indian youth with lived experience to kind of help guide some of the conversation. We were also on a very short timeline and kind of sped things along, as our friends at the Research and Action Group said. So we had our number of people that we were able to interview and everything during the times of this research and evaluation project were really shortened, but we did get a lot of great information. So just to highlight a few things, we interviewed 19 youth participants who were working in Safe Harbor grantee programs, and the interviewees were invited to participate by staff across all grantees, and 10 of those grantees had people who did interview with us. The interviewees' ages ranged from, there were about 5% of the people who were 14 or younger, a third were 15 to 17, about 42% were in the 18 to 24-year-old range, and then we had about 16% that were 25 or older. For the interviews, 95% identified as female. At the time of the interview, respondents had been receiving programming for 3 months or less. And that actually anyone could be part of the interview, but we asked them how long they had been part of the interview. 16% were 3 months or less. More people, about a third, had been receiving Safe Harbor grantee services from anywhere from 3 months to a year. And then the rest were over a year. And actually 20% had been receiving services from the grantee for 5 or more years. So the data from the survey included information that were collected over 2 years. So it was out in the field in a paper version and a web version. And so first I'm just going to kind of talk about the overarching findings that we heard in both the youth and interviews surveys. So overall, the youth that we heard from felt safe and respected from the grantees that they worked with, and were overarchingly satisfied with the assistance they received. We asked them about feeling hopeful, and most reported that they felt more hopeful about the future, that they had learned about available resources, how to access them, how to kind of navigate through the system. And another theme that emerged is that youth felt prepared to kind of access the ways in finding safe places and kind of building on healthy relationships. And overall, they felt supportive youth cultures with the program staff that they worked with and in the services. Now, again, these were themes. Not everybody mentioned that, but they did come through in our analysis of the survey and of the interviews. Another thing that we asked about was just how they felt about staff, and you can see some of the things that came up: relatable, dependable, staff helped youth meet their needs, they were accepting, and they were emotionally supportive. And again, this was one of the things that I think stood out very much in the youth and surveys and interviews, is that staff was really key to some of the supportive ways and the way that they felt that they were going to be able to be successful when the program, a lot of programs don't necessarily end, but just how they were building kind of strength because of staff. This slide just gives you a list of a whole bunch of questions that we asked, we asked people during the interviews what kind of services and supports they received to kind of gain. The grantees have a lot of different things that they offer, and some specialize in things like housing, and others have multiple types of resources that they offer. So as you can see, youth that were interviewed, the ones that we spoke to, most mentioned either case management or mental health as the most commonly used support or service. But there were other things from substance abuse to getting help connected to housing and education that came up. And some people, and most people actually that we interviewed, I think all people would list more than one support that they were getting from the grantee that they were working with. In terms of what they felt the most helpful services were during the interviews, emotional support from staff came up the most frequently, but also mental health supports and the case management supports with navigating through the system, and also employee assistance was another thing that came up the most often. We also wanted to know where there were gaps or biggest needs, and people may be connected to a grantee that was able to refer out, or may not have housing, for instance. But when we spoke with the youth who were interviewed, having a positive social connection was one of the biggest needs that was mentioned, as well as finding safe housing, and then of course mental health supports, and both educational and employment assistance came up frequently, and then basic needs such as food and security. We also wanted to talk with people just to learn a little bit about where they were in terms of service gaps. So when we looked at the survey, youth who took the survey were asked if they needed services beyond what they had received from Safe Harbor grantees who provided the services. A large majority, about 88%, indicated that they did not need any additional types of services at the time from their perspective. For those who did need additional services, the most common were mental health services at about 49%, and then over a third, which was transportation and finding housing and keeping a job, were the places during the survey that they said there were service gaps. A slightly different themes emerged when interviews were asked what youth wanted, kind of, if any kind of services they were hoping to get through Safe Harbor, but didn't receive yet. And in the interviews, the youth identified that employee assistance at 42%, and then also the housing and mental health supports came up as they did in the surveys, and then independent living skills. So again, just to point out, these are questions at a point in time. It's not to say that the services weren't available by the grantees or that and the people who said that they didn't need any services at the time weren't asked if they knew about all the other services available, but there were services gaps that kind of just were around that part around the other pieces around like childcare came up, and chemical health support and healthcare were other things that were mentioned. And lastly, before I pass it on to Melissa, we did ask what we wanted to just kind of find out for them what was the most important thing that they felt that they accomplished through the program. And most often youth shared that they built their self-confidence and they gained self-respect. Other common accomplishments were securing employment, finding stable housing, improving communication skills, being able to focus on education, meeting their basic needs, ending toxic habits, and generally improving their lives. And I'll add that all survey respondents said that they felt more hopeful about the future since receiving services. So that was all 100% of the people we talked to. And almost all survey respondents felt that staff at their program that they are working with respected their culture, and that they provided services and resources that fit their cultural needs. So I will pass it on to Melissa for the key informant overview.
Hi everyone, my name is Melissa, she, her pronouns, and I will be mostly talking about the community respondent key informant interview results. And so these are just kind of a sampling. There's a lot more in the full report, and so these are just kind of the most common ones in each of the categories. So we asked about the changes that people have observed since 2019, and the most common one was that there's an increased kind of level of awareness, understanding, opportunities to learn about trafficking. So MSS data, this person on the right-hand side of the quote, is talking about kind of debunking the myths about what trafficking looks like in reality. We also heard a lot about increased collaboration and communication across organizations and across sectors. So just kind of that relationship building piece has also improved since the last evaluation. You go to the next slide, Julie. Some other changes we heard about is just improved access, improved availability. The quality of services has increased over time. The protocol development to those kind of opportunities have improved. So not only are more communities developing their own protocols, but also they are getting enhanced. They're improving over time and kind of maturing essentially. And similarly, systems just overall are kind of maturing. They're kind of better equipped, better prepared to address trafficking when a youth, is identified through one of those systems. You could go to the next slide, Julie. Then we asked about challenges, and I think the number one challenge that we heard about from community respondents is the identification piece. And so just really making sure that professionals, staff that are working in these sectors understand what signs to look for, what it actually looks like. Again, it's, this person on the right, again, is talking about what the stereotype of what trafficking actually looks like. And, that's still common, even though, since the last evaluation, we did hear that it's improved. It's still definitely a challenge, and still the challenge that we heard about the most. And then we also just heard about, insufficient services, there just not being enough funding to go around the state to make sure that the needs of all survivors are actually met. And then related to that is staffing. So just turnover, that sort of thing, just really retaining staff and making sure there's consistent staffing for youth who are being served. And then lastly, again, just that lack of understanding of what trafficking actually looks like, how it relates to social determinants, those core causes. I think there's still some room for opportunity there. You could go to the next slide. And then we asked about cultural responsivity, and these were kind of the most common themes that we heard. So, again, just the importance of making sure that youth have the staff that are serving youth actually reflect the youth that they're serving, making sure that services are also designed in that way to make sure that the youth that they're serving through their organization feels like they belong, feels like they're seeing their identities reflected in services and the staff there. Just really making sure that there are more culturally specific, more culturally responsive services, making sure the services that exist already are culturally responsive. So just kind of continuing that effort. And then lastly, many people also talked about just making sure that efforts are community led. So that kind of authentic partnering, making sure that communities are part of the solution from the beginning. And then we also heard about just making sure that knowledge is there for the staff that work with youth, making sure that that education piece exists. Again, working to build relationships with specific cultural communities, with culturally specific organizations. And then lastly, obviously Safe Harbor touches a lot of systems that have been really rooted in white supremacy, systematic racism. And so just continuing to to address that issue, I guess. So. And then these are from the youth and community respondent interviews. This is just really the impacts of COVID. And again, there's more in the report, but the number one, obviously, I'm sure is not a surprise for anyone, is just the shift to remote communication, providing services. There were a lot of challenges there, similarly accessing services was more difficult. Youth couldn't just walk into an office in a lot of cases to access services, especially, with a population that might be highly mobile, and just kind of, that access to technology was more difficult. So ultimately just making it more difficult to access services. A lot of efforts were canceled or postponed, so things were kind of getting pushed back. Court cases obviously were really building up, so a lot of these things just got pushed back. And then obviously just the situation of the pandemic generally really created an environment that was ripe for trafficking to occur. So, financial stress, social distancing, isolation, those sorts of things really contributed to an environment that was conducive to trafficking. And then similarly, identification was just more important. So we heard a lot about, kids not being in school, and so school staff and teachers just less likely to notice that a youth might be going through this experience. And then I'll just go over our overall recommendations really briefly. So the number one, aligned with the number one challenge that we heard about, is just really making sure that staff are able to identify youth and across all sectors, just really making sure that they have the skills, they know what to look for, that sort of thing, to make sure that youth are identified as early as possible. Expanding protections and services to all was also really common, regardless of how old the person is. Increasing access to services, and this was particularly emphasized for youth who are BIPOC or LGBTQ+, and then youth living in greater Minnesota. And then just making sure that staff, again, are diverse, making sure that they're reflecting the youth that they serve, and that staffing is consistent, kind of addressing the staff turnover issues. And then providing more technical assistance, more education, more training, there's always a need there. And then just really making sure and prioritizing cultural responsivity within all of those opportunities. Focusing on prevention was also commonly mentioned. So this included both addressing demand and then as well as risk factors for experiencing trafficking. And then lastly, just making sure that the evaluation process is kind of more ongoing to make sure, that we're engaging grantees on an ongoing basis, collecting data in a more real-time way, just so we have a better sense of how the Safe Harbor system is operating in more real time. And that is it for us. I think we have about a minute for questions if anyone has them.
Thank you so much, Julie and Melissa. This is such helpful work, and it's particularly powerful, I think, to hear these recommendations after hearing our previous presentation and where we need to be focusing our work even more in meeting the needs of different populations. We do have one question here. Were youth from new immigrant communities? The person asked were youth from immigrant communities included in the BIPOC category? And they put also new immigrant communities in there too. So I guess existing in the newer immigrant communities.
I think for the community respondent perspective, it was really, we do have some themes that are really specific to certain communities, but I think a lot of the themes that we heard about were relevant for any BIPOC community, and I think that includes immigrant, refugee communities and that sort of thing. So I think those definitely relate. I mean, I think our the number of youth and community respondents that we got feedback from, is just not, we're just limited in how much we're actually able to kind of disaggregate the data. I don't know, Julie, if you have other thoughts there, but.
Yeah, no, I agree with that.
And that is something, as many of you, of course, are familiar with the REDCap system now at MDH, and we are getting more data in specific populations that we weren't collecting before. And so as we move into our next rounds of evaluation, we might be able to get more granular in looking at the different communities that are involved in the Safe Harbor system. I also wanted to point folks out to the, when you go to the web page, which I put up on the chat, where you can access the information from Wilder, you can also access an appendix, which goes into some more detail about aspects of the data that Jory Catalpa, our former Safe Harbor evaluator, put together. So we kind of have our overall shorter legislative report, and then we have a deep dive from both Wilder and the Safe Harbor program at MDH into all of the data. So yeah, thank you so much, Julie and Melissa, for joining us today. As always, your work is so helpful to us in Safe Harbor and understanding where we can do the best possible work in our system. So thank you again for joining us this morning. And I'm going to turn things over to our next mighty team of people led by Heather Callier, and you're going to open up their presentation.
Thank you very much. And I'll invite my co-presenters to turn on their cameras as well. And are you seeing what I'm seeing? Okay.
Yes.
Okay. Okay. So Joy and Bukola and Lindsay, are you able to turn your cameras on?
Yes. Yep. Can you see me?
Mine is on.
All right. Wonderful. Hello.
Hello. Hello.
So hi. So thank you very much. I'm Heather Callier from Ascend Consulting, and I'm very excited to share this project with you and as well with my colleagues here who joined us. And I just want to also say thank you to Research in Action Wilder. Those were fantastic presentations. I can't wait to read the reports. So I made some notes of some things that we found in our project as well that kind of crossed over. So it was really interesting. So I will tell you a little bit about this project. But first I would like to just acknowledge that people with lived experience were identified to participate in this project based on their expertise in past professional consulting experiences and their expressed interest in becoming subject matter experts for the Minnesota Department of Health Safe Harbor program. So, and funding for this project was made possible by the Mille Lacs Band of Ojibwe, and I really want to thank the Commissioner of Health and Human Services, Nicole Anderson, and Kristen Allard, the Family Violence Prevention Program Administrator, who really just gave us kind of free rein to do this project. And similarly, we were on a tight time frame. We had, I think, a pretty tight time frame. And but I'm really, really excited about this project. So Our survivor leader and subject matter experts who are with us today are Lindsay, Arf, Joy Friedman, and Bukola, Oriola, and they will introduce themselves and just say that the other subject matter experts that contributed to this who could not be with us today are Lateesha Coleman, Monica Miller, and Chris Stark. So with that, I will just take a second here and actually ask Lindsay, Joy, and Bukola to just introduce who you are and what you do.
I'll go. My name is Lindsay Arf. I am a survivor of trafficking. I've been speaking and training and educating people on this subject ever since I got out of the life about 8 years ago. And I worked at Breaking Free for about 5 years, and I've moved away from Breaking Free, and I've kind of broke loose, and now I'm kind of on my own. I still am a consultant for Safe Harbor, and always have been, always will be. And then I'm trying to develop my own consulting kind of thing right now. So it's kind of like a new stage in my life right now. So it's kind of exciting. So yes, I'm Lindsay Arf.
Thank you. Bukola?
Good morning, everyone. My name is Bukola Oriola, and I'm from the Anyton Story. Thank you.
And Joy? Sorry, Joy, I can't see you, so.
Oh, I'm sorry. I'm here. I'm here. I'm Joy Friedman. I am a consultant for the missing piece, and I'm happy to be here.
Oh, I just like rambled. Sorry.
Oh no, you two are being very, very humble and modest, but we are very, all of you are. We are very fortunate to have all of the subject matter experts who are in this project just bring so much to the table and just have so much for all of us to learn. And I'm just really just want to take this opportunity to thank all of them. And I was really honored to be part of this project. So for those of you who don't know me, I'm a consultant. I've worked with survivors for the last 15 years. I work with nonprofits across the state and also with state agencies on safe harbor and domestic and sexual violence issues. And part of what I do is helping to give voice to survivors and to some of these projects, some of the marketing communications projects and events and trainings that have happened throughout the state. So this was very important and dear to my heart to work on this project. So I will give a project overview real quick, and then at the end here, we will have time to hear from the experts, which is the most important thing. And so I'm going to try and blow through this overview pretty quickly, and I will just invite my colleagues to jump in. If there's anything that you want to add, feel free to do that anytime, okay? So this project started, I call it a courageous keynote, but for the 2022 Virtual Safe Harbor Conference, there was a keynote by Chris Stark, and then there were many breakout sessions that were really trying to describe the frustrations. I felt like there was like this underlying theme with survivors, the frustrations about still, even in the movement now, the anti-trafficking movement, people, professionals, different people who are asking survivors for input or asking survivors to speak or consult, just really need some more training and education. And please hear me, this is like Brittany said, this is not just like a webinar. This is like some deep training and education that needs to happen, because here we are all these years later, and we're still seeing the same things, and we're still re-victimizing and re-traumatizing survivors often, and not out of ill intent or malice, but just because of a lack of understanding. So there's that piece of this, and that was coming out in this keynote that Chris Stark shared, and then many survivors have also been sharing this, and I've seen this firsthand in my work with survivors over the years. And it's something that I really felt like there's something we could do about it. And so speaking with the Safe Harbor team at MDH, and we were able to find some time and some funding to do this project. And we're really saying that this is phase one. We're really hoping that phase two will happen. But this phase one was really listening to and centering the voices of survivors, these ones who are doing this work, who have been doing this work, who have a lot to offer. And that doesn't mean that there aren't others that we would love to involve in this, but for the time and purpose of this project, we had 6 diverse members of this listening team and development team. And one thing I would just like to say is actually Bukola is the one who said this to us during our planning session, that there's no amount of money that will ever compensate for their experiences. And I just want that to sink in, because we're going to talk a little bit about some of the other things that we discovered. But while strides have been made to center the voices of survivors, really it doesn't seem to be like best practices or like standardized training that happens within agencies or organizations that really help people understand what you're asking a survivor to do and what that means and the impact that it has on them when you're asking them to contribute to this work. So we created some suggested training outlines, some tools and resources for survivors and other anti-trafficking professionals that can be used now. They're available. You may have seen them. I know our friends at MDH have sent them out, and they've actually been circulated to some other national programs and been getting good response. And we welcome you to review these and read the report, use the tools. We really hope that you will read this and use it. So considerations: language and terminology. Words matter, labels matter. We went round and round on subject matter experts, survivor leaders. There's a lot of different labels that we put on folks. And, the survivors that we were working with here said, they don't really want people putting those, not like I'm a thriver, not a survivor, and putting that pressure on people, as well as saying, there are other survivors that maybe don't want to be consultants or presenters, and they still have the same value to the movement as those who do. And so just being very careful about what we're calling these people with lived experiences. So for the purpose of this report and the purpose of the information we're sharing today, subject matter expert and survivor leaders are kind of used interchangeably. Subject matter expert, this is the definition that these experts came up with, refers to someone, we think this refers to someone with lived experience on a specific topic doing professional work. So that means survivors who are out of the life and working professionally as consultants or in programs and things like that, rather than engaging clients who are still in a program. And there were very strong feelings about this, and I'll let them speak to it. So I'm just going to keep going here. Another consideration is that recommendations that we're making and the needs that were identified are not representative of all survivors or all anti-trafficking professionals. We created, what we're recommending based on the experiences of this group, and we realize it's not representative of everyone. Also, cultural considerations. This is huge too, and something that Research in Action kind of touched on, but there's a big chasm of understanding. So first is cultural considerations. This is Chris Stark actually said this when we were putting this together. There are different ways of relating and moving in this work. As an example, working with and serving fellow relatives in the Native community, and a priority to go about our work with great humility. And that might be very different than, for sure, the way that many white folks are doing this work, and people from all different backgrounds and cultures. So that's one consideration. But there's also, we found in the experience of this group, a vast chasm of understanding about culture, class, and money as it relates to engaging survivors. So like, you know, this is something I witnessed, I've been guilty of too. And I really think we need some more training as a movement about this and just how money triggers trauma for survivors. So when you're asking them to do something and you're giving them, you know, a Starbucks card or or even if you're paying cash and there's like not clarity around the conditions or the contract or anything, like it triggers things and there's just assumptions being made, like this person can come and present for an hour and you don't pay them for a month. Well, they need that money, you know, or just assuming someone can pay their own travel or they can provide their own daycare. Like there's just a lot of assumptions that are about class and money that we need to consider. And also the inherent power dynamics of money and whoever holds the purse strings of what's happening at the event or the contract or the project that you're working on, that you're engaging with survivors. So that being said, I'm going to just move on to what this project was. So our project was to take these experiences, facilitate some listening sessions with survivors, and develop these tools, as well as a project summary report, because this, as I said, was like phase one. So we kind of wanted to lay the groundwork of like, this is more than 1 or 2 webinars. This needs to be something that's ingrained in our work, ingrained in Safe Harbor, ingrained in the movement here. So how can we increase the consulting capacity of survivor leaders in a healthy way? And how can we train other professionals that are engaging with them to understand these things? So that was sort of the goal. We didn't really know exactly what we're going to come up with, but we did a process of 3 listening sessions that were on Zoom that were excellent. And then we did a lot of feedback back and forth in between. And this is what they decided to come up with. So we wanted to identify barriers in presenting and consulting for professionals. So these were self-identified, like a needs discussion we had with this particular group. Again, it's not representative of everyone, but there were some major things that if you're going to move in this work and do so professionally, there's some gaps for a lot of folks that we need some professional development capacity and things like that. So that's within our recommendations. We also researched other existing tools because we certainly don't want to, you know, recreate something. We'd love to use things that are already in existence and support other survivor leaders who have already created things. So we researched those, and that's in the report as well. And there are probably many more that we didn't research, but for the purpose of this, we reached just what we could find. We wanted to identify coaching topics and public speaking and consulting best practices for survivor leaders and subject matter experts. And then we really wanted to focus on trauma-informed self-care before and after these opportunities, because as our experts will share, like, you're not just asking someone to show up and speak for an hour. You know, this affects them all the time leading up to it. They have to do it, and then it affects them after the fact. So making sure that if you're an organization or an agency, that you are not only respecting the amount of time and impact that it has on people, but also what you're really asking them to do and the after effects, so that you have either staff or somebody who's following up with them and making sure that they're okay, you know? So we'll talk a little bit more about that too. So we wanted to create a toolkit of resources that includes like sample contracts, email communications, tools to help empower survivors to move them forward professionally as subject experts. And we developed a tip sheet for agencies and people requesting presentations and consultation from subject matter experts. This includes like things about how to communicate with them, processes, payments, clear communications when working with them. So this tip sheet already exists and it's in this report, and we encourage you to use it. And then we provided a summary report and plan for implementation of future trainings. As we were doing this, and I'm going to keep an eye on the time, as we were doing this, we kind of realized there were 2 distinct audiences. I kind of went into it thinking we were just going to do this for the survivors. But we kind of realized, well, it's 2 distinct audiences. We need 2 different trainings. So the first audience are primary, the primary survivor leaders and subject matters. And that includes people who are aspiring to do this work. Our secondary audience are professionals and community members who are engaging with survivors. My thing is, so that includes Safe Harbor grantees and partners, other systems professionals, policymakers, criminal justice professionals. That one came up with quite a bit. Faith-based and other community groups. This is a big one where, oftentimes they don't have budgets, so they're like trying to get people to come and do things for, inappropriate compensation. Not always, but sometimes. Funders who are asking survivors for input, or researchers, or anybody who's, doing surveys or anything like that. And then other professionals engaging. So I feel like I'm like really blasting through this, but I want to because I want you to hear from our experts. So you can find all of this in the report, but our subject matter expert training outline, these are the high level topics. There are many, these are designed to be like modules. So each of these modules has several different topics within it, but these are the high level ones. So what is a subject matter expert? How are subject matter experts engaged in this work? How do you work with systems and some of the pitfalls of that, of like re-traumatizing and re-triggering things that can happen? Public speaking and contracting and consulting basics, small business operations administration. This was a big one, and there was a lot of things under that category that that they recommended for their training. What's fair compensation? What are the boundaries and expectations in contract negotiation? And then, are you ready? And that includes as like a self-assessment to see if you really want to do this. And for community members and professionals, we, again, there are many topics underneath these categories, but again, what is a survivor leader and subject matter expert? Who are they ready? Are you, when you're asking somebody to help with your project or event or anything, are they ready? And how do you avoid re-traumatizing them? And when they are triggered, what do you do about it? And how do you handle other people who are on staff who are not survivors and their interactions? It's complicated and messy, as we all know. And then how to appropriately engage with and contract services with these experts. So we suggested that these could happen through a variety of webinars and videos with the accompanying handouts and tools. We could design an e-learning platform with a certificate, or create like a learning institute, which would be like an ongoing coaching academy for survivors. Could be a consulting bureau, and I know some survivors are already doing this on their own, and so we don't want to step on any of that. And referrals to those who are already doing it. And then just let me say, I want to stop 1 second here and say, all of these trainings, while I or someone like myself might help to like coordinate and structure some of this, we really believe that all of these trainings need to be done by survivors, and they need to be fairly compensated to not only design it, but to deliver these things as well, and to be able to help empower the next wave of survivors who are doing this work. So yeah, and again, it really should be more engaging and not just like, yeah, I watched this webinar, check the box. Like, these are things that need to have discussion along with them, especially, well, for both target audiences. So that's that. So the resources that are available are in the report, and I'll just quickly tell you, there's recommendations for engaging survivors. There's public speaking and consulting best practices tip sheets. There's email communication tools and templates that survivors can use, booking request and services form templates. And I would thank Bukola for helping us. We shared some of her tools that she already has. And initial proposal and contract templates. This is a big stumbling block for a lot of survivors. And yeah, so those are the tools that exist. Please check them out. And so let's hear from Bukola. And I want to hear from the experts. And I'm so sorry, I went as fast as I could. But please, Bukola, will you help us understand what's important to know about interacting with subject matter experts when you're requesting their help or support or in participation?
Thank you so much, Heather. Excuse me. We don't have a lot of time. So what I will suggest first is to go get a copy of the recommendations. You know, the list is there for you to use as a guide. And I will really emphasize the importance of coming with respect to survivors when you want to engage with survivors as subject matter experts. And while we have a lot of people working, willing to work with survivors as subject matter experts, we still have a lot of people causing harm in that process. And how do we avoid causing harm in that process? Is being clear from the upfront of what they are going to do, what is expected of them, how much you have to pay, if it's going to work for them or it's not going to work for them. You know, their stories. I always say, for me personally, I chose to tell my story, and that is my power. And whenever I don't feel like telling my story, I don't need someone to tell me to tell my story.
Yes.
You know, I choose that. And we have to remember that for survivors, the power to choose is one of the things taken away from you during your experience. So when you come asking the same thing, it's like you are taking that power away from that person. So let the survivor choose how or when they want to tell their story. And when they've done work, it will be good to focus on the work. And I think that Heather did a very good example of that today by focusing on the work we did rather than even mentioning any of the experiences we shared in the process of doing that work. Thank you.
Thank you, Bukola. Lindsay, will you please talk a little bit about compensation and what are people really asking subject matter experts to do and the impact it has on all of you?
Right. So when you're in the life, money, it rules. It is the life. It is. It's what circles, right? It controls. If you can go home at night, it controls everything. If you can sleep, eat, whatever, money is that. So it can be very triggering, handling of money. And then also it can bring up those really icky feelings of shame and those moments that you just had to take that small amount because you needed to do it, because you were in that moment of needing to take care of your family or needing to pay this one bill. So you really did something that you really normally don't do. So like with those, just, I don't, someone else can, maybe somebody can kind of understand that or kind of get what I'm saying. But so when it, can you kind of can you answer or say that again?
Yeah, Lindsay, I want to say, and I want everyone to hear this real clearly. Do not make survivors ask for their money.
Right.
And don't make them, like, you need to be upfront. I'm asking you to do this. This is the budget I have. These are the things that I want you to do. If the budget doesn't work for them, they need to be able to say, no, I can't do that for that budget. And this is what it would cost because this is my professional time and what it's worth. And, like every time you make somebody, a survivor, chase around for the money that you said you would pay them after the fact, it's humiliating.
Right. A few times, I've had, I've gone a really far, I'm just going to say like out to Breezy Point, and they thought it was just that they were just going to pay for the room and board or the place, and then that I wasn't going to be paid for speaking, but I did have an advocate that did advocate for me and got something paid, which yeah, Safe Harbor, Safe Harbor did it, because they're awesome. But it wasn't Safe Harbor's thing. It was somebody else's. It was another company. But that really made me feel so taken advantage of. But then I was like, Lindsay, why aren't you getting your ducks in a row? Then I got bad on myself. And I'm like, Lindsay, why aren't you so I'm getting hard on me. So there's a lot. And that's right when I got into it, right? So there's a lot. And so this tool that we just developed, me and these 6 other women, or these 5 other women, man, this tool is amazing, you guys. Someone that is just maybe a year out of getting out of the life, because we don't want them speaking immediately, right? We don't want to re-trauma that, because a lot of people like to do that, have a person that is immediately out of the life start speaking. No, like, give it some time. How about a year out of the life, and maybe itsy bitsy, telling a little bits and pieces of part of the life, but then they get to look at this tool, and it's so easy. It's so easy to make sense of, like, it's easy for me now. It's just easy for me now that I've kind of stepped away, and now I don't, a lot of times I'll have my Safe Harbor, people, be like, can you help me? Kind of a thing. Hopefully, I can stop doing that. But, they're always there to help me. But
Thank you, Lindsay. Thank you so much for sharing all that. And so I know this time went way too fast, but Joy, no. Caroline gave us some few extra minutes.
Yeah.
Thank you, Caroline.
Yeah.
So Joy, bring it on home, sister.
Yeah, thank you so much. And it's an honor working with all the ladies who are on this project, and to come and share with you guys. What the templates do is actually do what Lindsay was talking about. Takes a lot of the stress out of for survivors or individual experts who are coming in, whatever they want to call themselves. That's a key piece right there, is ask individuals what they want to refer to themselves as and let them guide you. These tools help us understand that as individuals coming into this movement and may not know how to navigate it, coming together as a team to create the simplicity for a newbie is what I call it, a newbie to start. And for professionals who are not understanding the damage they do with, as Heather said, not intentionally, but with the request and how you come about it. And as Bukola said, telling us we got to tell our story. We are subject matter experts, which means there's so much more to it that we can talk about and that we know about that can help individuals put together good programs and good services that can actually do some good with survivors. So these templates here were put together for both sides to be able to navigate this easier, to do less harm as you interact with individuals, and we continue to make more and improved tools. Thank you.
Thank you, Joy. So I know Bukola had a real passionate call to action that she wanted to share, and I think we all share this sentiment. So Bukola, do you want to close us up?
Thank you so much. I think the call to action was already in what my colleagues shared about go to the templates and follow it. It's one thing to talk about this, it's another thing completely to put it to action. And I would like to call on MDH and other state agencies here, awarding grants and working with different grantees and all of that to do this work. As important as this work is and how people have good intentions, it's always good to evaluate how we are working with survivors as much as we are evaluating the whole programs. evaluating in terms of not just did you work with survivors as subject matter experts, evaluating in terms of what does that look like? How meaningful was that? And even doing it in a way where survivors themselves are giving you some of those feedback to look back to and make changes, because everybody, I believe, have good intention for coming into this work, but sometimes we do make mistakes. Nobody is perfect as we are trying to do the work. But if we're evaluating the program as a whole and we're not evaluating this part of it to make sure that we're not causing harm as we continue to do this work, we'll continue to talk and talk and talk and talk. And I must tell you that for some people, we are tired of talking. We want to see the action. The same goes for the grantees doing the work, saying, oh, we are working with survivors. We want to include survivors in our work. Or we even hire the staff to help us work with survivors. How is that really translating into meaningful interaction and engagement and respectful interaction on both sides of the aisle? So these are things we have to continue to think about and make changes towards. Thank you.
Thank you, Bukola. So I'm going to wrap up. We'll send this PowerPoint and all the tools out. Caroline or for MDH, we'll send it out. And I just want to say thank you to my colleagues, these subject matter experts. Thank you for allowing me to even work alongside you. And I respect you and I trust you and I appreciate you. So thank you for sharing your expertise. And I will stop sharing now.
Thank you. Thank you so
Thank you.
much, Heather and Bukola, Lindsay and Joy. And I just want to say, I think this whole meeting today was a call to action. Just so powerful, so much for us to do in terms of accountability in Safe Harbor and in the whole human trafficking movement response in the state. And I just really want to thank all of our presenters today. This was a really important and powerful task force meeting. I also just want to briefly say, for Safe Harbor, a quick note about some things that are coming up. We will have our request for proposals coming out in February. That is for our supportive services and regional navigator grants. I also know that the Department of Human Services will be issuing their request for proposals for housing and outreach. And we are looking at everything that has been brought to us through these reports and presentations to really inform that grant making process. I also just wanted to let you know that we will be issuing a call for proposals for a strategic planning process for Safe Harbor, hopefully this week. And so please keep an eye out for that. I will be posting that. And a lot of the information that we've learned today are informing all of the work that we would do in a strategic planning process and an evaluation process, which will be starting up again too, as soon as we finalize our contract with our provider for our biennial evaluation. We are also updating our hotel training, and some folks will be encouraged to participate in that work. We've been required under state statute for about 4 years now to do a hotel training, and it is something that needed updating. So we are really excited that that is being put together as well. And with that, I just want to say thank you again, and thank you to all of our Safe Harbor partners, grantees, everybody who joined us today, and most importantly, the survivor subject matter experts who joined us today to provide such important information. Thank you again, and have a great day.